Scientific Sessions 2021 is now live. Hi, I'm Kara Moore.
Hello and welcome to AHA TV, your source for science news and session highlights. My name is Trey Johnson. Over the next few days, we will bring you late-breaking science news and highlights from the cardiovascular event of the year. Day one of the program kicked off with our thought-provoking opening session, Scientific Discovery as the Guiding Light, moving toward a post-COVID world. Dr. Gary Gibbons led with a presentation on scientific discovery in 2021, how we are galvanizing it.
This SARS-CoV-2 virus was attacking the heart, the lung, the blood, the vascular systems, and indeed affecting our entire organ system collective, and we needed our investigator community to be part of the vanguard of addressing it. And so we urgently had to put together a research agenda and platforms to deal with this public health crisis. We've seen that the power of collaborative partnerships, nimble networks, and partnership platforms to promote inclusion and health equity for all.
A fireside chat led to input from panelists on the topic of COVID and vaccine development.
The issue of clinical trial really, as Gary pointed out, has to emphasize equity and inclusiveness. Study diverse population. You heard Gary about what we do in the US, that it has inclusive participation and develop trust in the community. I think globally, we also need to include Africa, low-income countries, so that those trials are really done and where people are really affected.
We need to think about how do we bring a scientific lens to addressing some of the mistrust issues that have been identified by Dr. Gibbons and Dr. Ferdinand. So at the patient level, we have exposed a history of mistrust. How do we start to address that with science to make a difference?
One of the things that the pandemic has laid bare for us is how our public health infrastructure from a data perspective really needs to be reimagined and recreated. And every public health practitioner needs to know how to access big data, how to utilize big data, so that we can get our hands on the next pandemic earlier than we were able to this time.
So we should expect that we're going to see some worsening of the cardiovascular landscape post-pandemic. What we need to do is empower our patients, educate them about their numbers, educate them about how to control their risk factors. Know your medicines. Don't go to Dallas from New Orleans and say what medicines you're on. I was on a white pill, a blue pill, a yellow pill. They should know the names, the indications. And telehealth may be a big step forward, but we need to get past the digital divide.
Happening now, the Resuscitation Science Symposium. To lead off the symposium, attendees were able to get updates from a series of speakers on updates in post-arrest targeted temperature management.
We wanted to build on the evidence that came from 2002 that we believed and many others had a level of evidence that was not good enough. So we wanted to build on those two trials. This is the HACA temperature graph from 2002. And what we wanted to do in TTM2 was to go down to 33, hopefully a little bit faster than in the HACA trial. And then we introduced this threshold of fever treatment to keep a temperature a little bit below the HACA temperature from 2002. The outcomes I will present is death from any cause, functional outcome, and health-related quality of life. These were the results of the trial. We screened 4,355 patients and randomized 1,900 out of these. I will come back to the reasons for not being randomized. And after removing those without consent, we had an intention to treat group of 1861, out of which we lost 11 to follow up. So in the survival analysis, we had 1,850 patients. So in summary, we had 1,900 patients from 14 countries, 61 hospitals, and the interventions were delivered according to plan. In out-of-hospital cardiac arrest or presumed cardiac or unknown cause, hypothermia did not lead to lower mortality. And the functional outcome and health-related quality of life was similar. And all these results were consistent in the predefined subgroups.
Our experience in Seattle mirrored some of the experiences that I just described throughout the world. We had a TTM protocol that was targeting 33 degrees from about 2002 all the way through April of 2014. And then we also changed our protocol to target 36 degrees after publication of the first TTM trial, and then actually have made a change back since 2017. At one hospital where I practiced in Seattle, we looked at our experience. We included 453 patients who received TTM, fairly evenly split between a period of time where we were targeting 33 and 36. The demographic characteristics are similar between these two cohorts. The TTM 33 cohort was slightly older and had slightly higher cardiac etiology, though there was no difference in shockable rhythm. And if we were to adopt a higher temperature goal, we need to ensure that the structural components of post-arrest care remain, even if our temperature goals change.
Don't forget to take time to network. You can do that by clicking on the Connect tab, then selecting Connect with Colleagues. Start a chat or schedule a meeting with new and old friends and colleagues.
Bringing in early career sessions with interview with nursing legends in cardiovascular science, CVSN nurses across the career trajectory got their questions answered by living legends, Drs. Kathy Dracup and Martha Hill, during a live session. Strategies for career success by highly effective scientists focused on the strategies used to increase effectiveness at work and in life, whether in the academic or industry. Highly successful scientists shared strategies to increase efficiencies at work and at home.
Presented for the first time, the AHA 2021 Dietary Guidance to Improve Cardiovascular Health Statement, published simultaneously in Circulation. Reviewing the guidance, followed by a discussion of opportunities and challenges for addressing environmental drivers of diet and cardiovascular health, population-based approaches to implementation, and implications of the dietary guidance for clinicians and patients.
The food industry essentially wants to sell food. If we can create a demand for healthier options, we're going to see more healthier options. And again, this is going to go out into multiple decades. And if the demand is there, then we'll see a shift, I believe, in the food supply. But there are a number of different approaches we need to take.
Check out e-posters while you're here. There are thousands of posters, including moderated digital poster sessions, available each day of the virtual experience, made possible in part through support by Bristol Myers Squibb. Up next, let's hear from our chair of the Committee on Scientific Sessions program, Dr. Manesh Patel. Dr. Patel, what are your impressions of the first day of this program?
What a great day we had on Saturday, where we started it off with an opening session where we heard about the post-pandemic world, hopefully, and a way forward out of the darkness with science. Gary Gibbons gave us a talk on the National Heart, Lung, and Blood Institute's perspective on how to galvanize science. And then we heard from a wide-ranging panel on how we can actually lead that to community health and lead that to actual health policy. So I thought that was really exciting. The other session that sort of caught my eye, a few of them, there was a what have we learned over the last 10 years in cardiovascular health? That main event session really highlighted for us where we've gone and where we're going in cardiovascular research and science. The COVID session with the CEOs of Moderna and the Chief Medical Officer from Pfizer and Nancy Brown, our own AHA CEO, and Ray Vera, the Chairman of the Board, was a great fireside chat to talk about just how fast we were able to make those vaccines and the science that led to it, but what the cardiovascular implications are and how we might have other therapeutics. Really another exciting session. Looking forward to Sunday. Obviously, the presidential lecture from Don Lloyd-Jones. I think it's going to be inspiring. It's going to be a call to arms, and it's going to tell us how we get to a healthier future. He's really a visionary here, and I think we're going to like that conversation. There are other award lectures on Sunday, and then, of course, late-breaking science. So we look forward to tuning in with the AHA Scientific Sessions and a great Saturday opening day.
And that's a wrap on day one. Highlights of Scientific Sessions 2021. Come back to AHA TV anytime from anywhere to watch sessions on demand.
And don't forget to use hashtag AHA21 to share your top moments from the program. We'll see you again soon.